Excellent. Welcome, everyone. Good morning, and welcome to our Act and Process lecture series for Committed Action. This is our sixth talk. Actually, this is our seventh talk in the series, and where we have been reviewing the Act and Process lecture series. We've been reviewing the ACT hexaflex model. Today, we're going to review the ACT process of committed action. And I'd like to introduce our lecturer, Dr. Vidal Annan. Vidal Annan, PhD, is a clinical psychologist and currently serves as a senior director in the Center of Mental Health Care and Resources at the Georgia Institute of Technology. He is also a psychologist at the Behavioral Care Center of New Jersey. Over the course of his career, Dr. Annan has worked in multiple clinical settings, treating a range of mental health concerns. As an ACT practitioner, he uses this approach to address the mental health needs of his clients. He is also an ACT trainer, and his book, In My Feelings, which focuses on how teens and young adults can learn to accept their emotions, was published in June 2023. And we would like to welcome Dr. Annan as he presents our topic on committed action. Just as a heads up, if you have any questions during the presentation, feel free to share them in the chat box, and we'll have a chance to address the questions at certain sections, and we'll have to be able to address larger questions at the very end. So thank you, Dr. Annan, and I'll pass on the mic to you.
Thank you, Dr. Nassim. Appreciate the invitation and the opportunity to talk about ACT in this series and with everyone who is here this morning. I was just telling Abu that I was like, should I do it in the morning or in the evening? And I kind of went with 10 o'clock, and I'm happy that those of you who have been able to kind of carve out that time to talk about ACT and committed action. I really appreciate you taking that time. So we're going to be talking about committed action, and if it's okay with everyone, I'm going to jump right into it and get going, so we can make maximal use of the time that we have. So I think that in sort of starting this presentation, one of the things that I wanted to do was just to kind of talk about my journey to coming to ACT. I think all of us who are here are sort of on that journey in one form or another. And I've done my fair share of proselytizing about ACT, and getting some converts. I'm happy to say that Dr. Abu was one of my targets many years ago, and I was successful in bringing him on to the ACT side. But how did I get to be an ACT practitioner? So let's go back to about 2013, and I was a newly licensed psychologist in the state of New Jersey, and I was looking for opportunities in private practice, and I came across an advertisement for a position, and I reached out and I spoke to the person who was the founder of that practice, and we had a really good conversation. And the name of the place was the Behavioral Care Center of New Jersey. And the person I spoke to was Dr. Miller, Dr. Lander at the time. And, we had a great conversation, and she asked me to come on board. And in the first couple of weeks that we were there, she kind of talked about the fact that she was in the process of exploring a new approach to treatment, to mental health treatment. And when she described it, the more she described it, it sounded more and more like where I was in my understanding of treatment and where I wanted to be. My foundations were in CBT, and with some psychodynamic psychotherapy kind of tossed in. But I was feeling like CBT had its limits. And so when Erica was talking about, this third wave approach called acceptance and commitment therapy, it really sounded like something I wanted to be a part of. And so I picked up some books, started reading, started talking to Erica, joined a peer supervision group. And many years later, here I am, someone who primarily uses ACT in the work that I do. So, thanks to Erica for that. And I don't know if she's here. Zoom kind of gives you limited view of who's present. But Erica, if you're out there and you are horrified that Vidal has put your face up on the screen, don't worry about it. Just take some deep breaths. Just be mindful about it, and everything will be okay. All right. So, just having worked in this field and doing a lot of work with ACT, it got to a certain point where I felt like, hey, you know what? Let me contribute to the field a little bit. And so, as Dr. Nassim mentioned, I kind of brought my ideas together a little bit and kind of put it together in a book that came out last year. And it's for teenagers primarily and young adults. And it's called In My Feelings. And the idea of the book is really based around the core process of acceptance and the idea that, again, feelings are not there to be chased away, gotten rid of, changed, all of those things, but that it's important data that if you can sort of allow yourself to understand what your feelings are telling you, it kind of helps you to be able to make other types of decisions in your life. So, pick it up if you have a chance. I would love to hear your feedback if you get a chance to read it. All right. Okay. So now let's jump into the thick of it a little bit. I know all the other presentations that have happened so far, everyone has focused on the hexaflex and kind of looked at theory a little bit. I was thinking about how much I wanted to go into this because if you have had a chance to be part of the previous lectures, you would have talked about all of these things already. But I wanted to kind of give it a context, maybe from my perspective. I think everyone who is in ACT kind of has their own different flavor of thinking about it and understanding it and using it in practice. So I wanted to kind of talk about it in a way that I understand it. And you may agree with some aspects of what I'm talking about. You may disagree, but hopefully it will lead to some conversation and give you some other angles of looking at acceptance and commitment therapy. So as I mentioned, and as all of you probably know, ACT is a behavior therapy. And I think that that's important, especially today, because we're going to be talking about committed action. And an ACT being an approach where behavior change has to happen. You have to be doing something different at the end of the treatment. And it is in that long line of behavioral interventions and behavior therapies, which includes cognitive behavior therapy, but it takes it beyond a little bit. It takes it beyond looking at internal experiences in terms of their form and trying to look at it in terms of its function and how it serves you in moving in the direction of a life that is rich, meaningful, and important to you. And ACT is not the only sort of third wave behavioral intervention. I think some people would say that DBT is part of that. Mindfulness-based CBT might be part of that as well. But it is in that tradition. There are many different ways to kind of get at the acronym. And this is one that I came across when I first started to explore ACT, and I think it captures it really well for me. So the A being acceptance of one's thoughts and one's feelings. C being choosing what matters most to you. And the T being taking action. Again, I want to zoom in, especially for today's presentation, on the take action part of it, because that's what we're going to be talking about. Russ Harris, who if you don't know Russ Harris in ACT, you should. I think he is one of the best promoters of ACT, and I think he does a really good job of being able to capture it in a language that many people can access. He makes it very accessible, and I'll make some references to him and his work in ACT as we go through the presentation. But here's one of the ways that he tries to capture what ACT is, and that the goal is to work to create a rich, meaningful life while accepting the struggle that inevitably comes with it. The presentation today, I'm going to be involving all of you. So I hope that you are ready to be involved and to contribute. So let's start that off early. So I put this definition, I guess, of ACT on the screen here. And I just wanted to kind of reach out, allow all of you to kind of give me a sense of what stands out to you in this sort of phrasing of ACT. Are there any aspects of this, any words that stand out to you, that capture you and kind of make you feel like, yeah, I can, this makes it meaningful to me? To work to create a rich, meaningful life while accepting the struggle that inevitably comes with it. Anybody? Feel free to unmute.
I think the rich, meaningful life is that's an important. I like the way that that's explained, and it's certainly for those of us who work with college students. That's a task that they're engaged in at that point in their lives, where they're trying to figure out how to create a rich and meaningful life for themselves. So I like that phrase.
Yes. Thank you, Mac. Yeah. So, the goal is to create a rich, meaningful life, right? And the meaning is unique to that individual, but that happens to be the path that all of us are on. Any client that sits in front of us, ultimately what they want is a rich, meaningful life. There might be some things getting in the way of it, but that might be the goal, all right? Anything else in this phrasing?
I appreciate the balancing of it with the inevitability of struggle, that, there's a dialectic in there of creating a rich, meaningful life alongside the inevitable struggles.
Yes, absolutely. Yes. And that it is inevitable that struggle will happen, and I think that, for those of us who work in ACT, that is a very strong foundational concept that we try to get across to our clients, is that, stuff is going to happen. Stuff is going to happen. Now, how you relate to that stuff that happens, right? How you understand it, makes a big difference in your journey to creating that rich and meaningful life. Okay. All right. Thank you. Thank you. To the hexaflex. All right. So this should look familiar to all of you. It is a diagram that kind of captures what the core processes of ACT are. Before I get to sort of the hexaflex in its true version that looks at the core processes, I like to present this version of it that focuses on what causes psychological suffering, and sort of ACT's theory of why humans get stuck and have a difficult time. I'll draw your attention to the middle part that talks about psychological rigidity, and everything that is at the different corners of the diagram are sort of, giving more definition, explaining a little bit more what psychological rigidity is in ACT and in the hexaflex. So I'll start from the left and then go right. So humans suffer because they engage in experiential avoidance, is one of the proposals here. And experiential avoidance is different from avoidance, because avoidance is in the real world and trying to get away from things that you don't like. Experiential avoidance is trying to get away from feelings that you don't like. Unpleasant feelings, unwanted feelings, painful feelings. And and the idea that if we try to avoid, change, get rid of, control those feelings, it actually leads to an increase in those feelings and leads to psychological suffering. Or cognitive fusion, which focuses on thoughts and how we relate to our own thoughts. And the idea that if we sort of get stuck on our thoughts, and we focus on the form or the content of our thoughts, as opposed to the function of our thoughts, that can actually make things more difficult for us. At the top is dominance of the conceptualized past or future. And the proposal for based on this particular concept, is that we suffer when we spend too much time in the past or in the future and not in the present moment. The present moment is where things happen. The present moment is where we have some sense of being able to take action. The past is gone. The future hasn't happened yet. And so when we allow ourselves to exist in those spaces, psychologically, it can actually be detrimental to our functioning. Dominance of the conceptualized self. Our understanding of ourselves is a concept, right? It's a narrative, it's a story. And we may have multiple stories about ourselves. And to the degree to which we hold too tightly to a particular type of story or narrative or conceptualized version of ourselves, that may not be workable. And we'll talk a little bit about what workability is, but it may not be beneficial to moving us in the direction. It might actually be too rigid, and it might actually get us stuck because we're not able to flexibly relate to other stories, other narratives, other labels that might exist about ourselves. Okay. And then you have values, which I will talk about more as we go along, but a quick snapshot of what values are is basically your sense of your truest, deepest, most meaningful self, who you are, what you're about, the path that you want to move forward on, how you want to be in this world. And that can be a guiding light for all of us. But if you're not clear on what that is, if you don't have a good sense of who you are and what you're about and what you want, that can actually be challenging and can lead to a lot of confusion. Some people argue that, depression is really about unclear values. You don't have a good sense of the direction that you're going in. So you kind of have that sense of being lost and powerless and not able to make change in one's life. And then the last part at the bottom right corner is unworkable action. This is action that is not aligned with one's values. These are impulsive actions, avoidant actions, but definitely not lined up with what is important to an individual. And so from the ACT perspective, if you're doing any one of these things or any combination of these things, you will experience some psychological suffering. You will be stuck, right? You will have a mental health condition. And so trying to move your client away from using any one of these approaches is part of the work that we do on a regular basis. Okay. So this is suffering. And another way that I wanted to sort of help us to kind of think about rigidity and inflexibility and how that relates to suffering is just to kind of break it down from sort of the six sort of core areas, core processes, and look at it just from sort of a perspective of three general categories. One of them is we suffer when we are closed, right? We're closed off from our internal experiences, and we're focusing on controlling, avoiding, or changing those experiences in some way. We may also suffer when we are disconnected from our present moment, and we're overly focused on the past or the future, or again, on some conceptualized version of ourselves. We also suffer when we are rigid and we lack engagement with our own values, and we respond to life out of impulsivity or an urge to avoid. Okay, so being closed, disconnected, and not engaged is another way of sort of thinking about what makes someone stuck, and what in ACT is referred to as being rigid or inflexible, and that leads to suffering. So here are the core processes, and this captures. This is in contrast to what I showed you a couple of slides before, and this is what health looks like. This is what psychological health looks like. Again, going from left to right, acceptance is about being able to hold your emotions lightly, not tightly, being able to allow them to come, go, or stay as they wish, as they do, and looking at emotional experiences as data that we can use in order to give us information to move in the direction of one's values. Cognitive diffusion is the opposite of fusion. So it's not about holding on to those thoughts and treating those thoughts as if they are the boss of you, but treating them as information that you are the boss of, and that you can determine if that information is serving you or not, right? Being present, again, is to not be in the past that has happened already and the future that hasn't happened, but being in the present moment where you actually have some ability to take action. Of course, in a way that is open and curious and free of judgment and self-criticism. Okay. Self as context, and this is where we have an appreciation of ourselves as, not just being a particular narrative, not just being a particular label, whatever it is our minds might be telling us about ourselves, but to kind of open up to the idea that there might be a version of us that exists above all of those storylines, right? Or another way that I've heard self as context talked about is that we're like a prism. We have multiple identities, and we can bring forth any one of those identities in a way that is workable, that moves us towards our values. I talked about what values are, and then committed action is what we're going to focus on today, which is where we take our values and we try to make it real in our lives in some form. And that flexibility, that psychological flexibility, is what leads to psychological health. So we talked about being closed, stuck in the past or future, and not being engaged. And so health is the opposite of that. So instead of being closed, you are being open. So you're not fighting or avoiding your thoughts and feelings, but you're allowing them to do what they do, because their feelings will do what they do. Being present. Not overly focusing on the past or the future. Again, not overly focusing, right? As humans, we cannot not be in the past or the future at different points. But when we are overly so, when we are stuck there, when there's a dominance of the past or the future, that's when it becomes a problem, right? But when we try to stay in the present moment of our experience a little bit, that actually tends to make us feel healthier. And then also being engaged with our values and working to make those values real in the life that we live, right? And being able to do those things is where health exists. And to really understand that when clients come to us, they're somewhere in between here, right? They're somewhere between the rigidity on one sense, being closed, overly focused on the past or the future, and disengaged from their own values, and being flexible on the other end, where they are open in the present moment and engaged. And our job is to move them along, right? By doing a lot of different things that are the interventions of ACT. Okay, one of which would be committed action, which I will talk about today. There are two other concepts that I wanted to focus on in understanding ACT. These are broader concepts that really capture, in some ways, what ACT is about. And some people even argue that these two concepts might be, what it boils down to in ACT. The hexaflex is great. I think it gives us a sense of where to act, where to begin working and what the interventions might be. But these two concepts kind of capture the totality of acceptance and commitment therapy. So I'm going to talk a little bit about these. One of them is workability, and the other is mindfulness. And for workability, let's go to the horse's mouth. Let's go to the big guy himself, Steve Hayes. And what he says is, let me move this over a little bit here. Okay, so he says in ACT, the focus is on whether believing the thought constricts or expands the individual's ability to live a valued life. This is often referred to as workability and is a central concept to contextualism, right? I think the important part to understand here is whether believing the thought constricts or expands the individual's ability to live a valued life. And this idea in workability that any internal experience we have, we can actually step back from that internal experience and say, is this working for me or not? Is it getting me there or not? Is it doing it for me or not? Right? That we are not fused with the thought and the form of the thought. Just because it exists inside of us does not mean that we have to go with it. Right? We can actually step away from that internal experience and determine if that internal experience is helping us to move in a values-based direction or not. Okay, so that's workability. And we'll talk a lot more about that. Then you have mindfulness. And then we'll go to another big time expert and hear what he has to say about mindfulness. So he says, mindfulness is awareness that arises through paying attention on purpose, in the present moment, non-judgmentally, and then sometimes I add, in the service of self-understanding and wisdom, right? So mindfulness is about being in the present moment of your own experience, right? And paying attention on purpose in a way that is open and curious and not judgmental and self-criticizing, right? And how can we exist in that space where we basically are holding our experiences lightly as opposed to tightly, and then we get dragged around, right? Okay. So that's mindfulness. And this is one of my favorite quotes from Maya Angelou. And actually, you know, as I was thinking about it, I actually like this quote because it actually lines up so well with ACT, right? So she wrote, if you don't like something, change it. If you can't change it, change your attitude, right? And if you look pretty closely, you can see the workability side of it. If you don't like something, change it. That is workability, right? But sometimes we can't change things in life. And that's where we can bring in the mindfulness, right? By changing our attitude, changing our stance, changing the way we engage with our internal experiences and things in the life that we live, right? So it kind of captures both of those. And so sometimes, you know, in talking with clients and helping them to be able to see the possibility for growth, I might make a reference to this quote and ask them what they think about it. And you know, very often it helps them to kind of see the possibility of change and how they may have been being too rigid in their experiences and how they can move towards flexibility and what that flexibility might look like. So workability and mindfulness are ways that we can learn to relate to our own internal experiences and actions in a flexible way. So let me kind of give you a description of that. So when we have an internal experience, a thought or a feeling, we can first assess whether it is workable. We can actually ask ourselves, we can ask our minds, you can actually talk to your mind, right? Is this working for me? And if the answer is yes, then go with it, right? People might agree, people might not agree, but if it is moving you in a values-based direction, go with it. It's a good thought, it's a helpful thought, go with it. If it is not, you don't want to get into the battle of now trying to quash the thought, get rid of it, you know, fix it. You don't want to do all of that. That's where you bring in the mindfulness. And you can use mindfulness skills to maintain some distance and perspective on that experience. And then you can actually choose to go against what your mind is telling you or what your feelings are telling you if it's not to your benefit. And you can actually choose to move in the direction of your values anyway. And this is something that sometimes clients who are stuck don't realize that they can do, right? They don't realize that the thought can be in my head and it could be punishing me at any particular time, but I can still decide that I want to go in this direction and that I can work to move in that direction if it is more meaningful to me, right? And so that kind of captures what workability and mindfulness are. And these are two concepts that can be used to be able to move a client forward. Here's something that I like to do. It may be helpful, and not just me. I mean, it is in the literature as well. But you can look at mindfulness and how it relates to certain core processes. And I would say diffusion, acceptance, self as context, being present, those kind of group together under mindfulness. And then the workability part, values and committed action kind of group together under workability, if you want to think about it that way. Okay. So I wanted to kind of end this section on just kind of review of ACT by showing a video that I came across. And I wish I could remember who showed me this video because I can give them credit for it. But it's a great video. and I will sometimes share it with clients. And I think it really captures what ACT is about and what the possibilities are. Now, in our pre-setup, I wasn't able to get it to play in the presentations. I'm going to have to stop sharing my slides and go to the video. So if anything crazy happens, guys, just stick with me, okay? All right, let me see here. So stop sharing. So you probably should just see me on the screen right now. And then I'm going to share the video. Can you all see the video?
Yeah, that worked.
Okay, great. All right, so all right, and I'm going to play it. There's no sound, so you're going to have to read. So pay attention, folks.
The video's not playing on our end.
Oh, no. You're not seeing it playing?
No.
Oh,
No.
no. Oh, let me see. Well, let me skip the video just for time purposes. Sorry about that, folks. I'm not sure why it's not happening, but
Did you try did you try clicking on because the video showed it wasn't playing on our side.
okay, let me try it let me give it one more shot. Let me see here. Okay, can you guys see the video now? Okay, so let me start to play, and I'll just leave it in this version, and you can tell
Yeah,
me.
it works.
Okay, so we'll just watch it this way. Okay. So let me stop sharing that and go back to the slides. Hopefully you found that a worthwhile view. Okay. All right. So now we're going to switch a little bit, and now we're going to really jump into committed action. hopefully I was able to give you sort of a general overview from Vidal's perspective, take it or leave it, right? So if we're going to talk about committed action, we have to understand that ACT is a behavioral intervention. It is, right? And when we're talking about committed action, we're really talking about how we can take our values and put them into action, right? A way to take effective, workable, values-based action. Actions that are in line with our goals, which are in turn in line with our values. And also actions that are flexible in response to the changing environments that we may find ourselves in. When we're talking about committed action, right, we want to sort of understand and communicate to our clients that clear actions come from clear goals, and clear goals come from clear values. And so you cannot really do committed action work well without having a sense of your own values. Okay. So let's talk about values very quickly. Values represent our deepest sense of how we want to live in our lives and relate to ourselves, others, and the world. It is the path in which we want to live our lives. When we're doing values-based work, there are a couple of things to keep in mind. Values are not nouns, they're verbs, right? So love is not a value. It's nice, right? But loving my family, right? Expressing love to my partner, that is a value in ACT-based language. You want to phrase it as a verb. You always want to start, right? When you're talking about values, you want to start it with a verb, because then it lends itself to action even from the conceptualization, right? You don't want to talk about integrity, right? No, you want to talk about living my life with integrity, things like that, right? Values are in the here and now, which means that they can change tomorrow, but for now, it feels true to you. It is freely chosen and strongly desired. Most people cannot feel life satisfaction if they are not living out their values. If they know what it is and they can't live it, it bothers them. They don't feel complete. Values are not goals in the sense that values cannot be checked off a list. I cannot complete a value. I can complete a goal, but I can't complete a value, right? And from a value, I can have 100 goals. And also values can be different for different aspects of my life. I might have relationship values, I might have career values, right? But you know, in all of those areas, it's about how I want to be and how I want to relate to myself, to other people, and the world. Identifying and clarifying one's values can provide a direction for one's life and provide a context and reason to deal with tough challenges. You know, when we are talking about values-based work and we're helping our clients, we want them to start to ask themselves questions like, is it worth it to me? If you are experiencing some challenge, is going through this challenge worth it to me? Is it in line with who I want to be as a person? Is it helping me to be more of who I want to be or more of who I am? Right? Those are kind of values-based questions that one can ask themselves in sticky situations. And it helps to kind of reorient them and give them that energy that they need to keep moving. The next activity I wanted us to do, again, for you all to be connected, is to talk about your values as therapists. You know, and so I kind of sprinkled on the screen all kinds of different values. And the thing about values, again, is that when you see it, you know it, right? Sometimes when we talk about values, you don't want to get too much into words. I will ask clients that when you see that value, you think about it, inside you, does it make you drop down? Does it leave you flat? Or does it lift you up, right? So you get them to be able to talk about it in terms of the experience of it. Because when you experience your value, it will lift you up. You'll feel the difference inside you, right? So again, a sprinkling of different values here as far as being a therapist. And which ones stand out to all of you? Which ones connect with you? maybe we could do this one as a chat. Maybe if you kind of, or if people want to talk, maybe that might be fine for a few minutes. We can do this for about a minute. One of them that resonates with you. Feel free to share. Let me see. I don't know if people are putting in the chat. Let me look and see. I can't seem to open the chat. I guess maybe as a host, I can't do that part of it. Maybe. Oh no, here it is. Okay, I see. Okay, yeah. Teaching others, learning new things and empowering others, creating opportunities, right? So all of us are doing the same job in terms of being a therapist. But that thing that moves us, that thing that guides us, that thing that makes us feel at the end of the day that we've done something good and makes us feel the best version of ourselves might be slightly different, right? And so I appreciate all of you sharing. For me, after doing some, internal work, as we say, the way I sort of kind of captured my values is really about empowering for me, right? And I kind of found a way, and we can work with our clients to do this, is to phrase it in a way that you can say it to yourself in difficult times to orient yourself, right? And for me, it's about empowering others to move from their point A to their point B, right? Empowering others to move from their point A to their point B. Helping, yes, that's great, but empowerment means a little bit, it resonates with me more. It captures what I'm about more, right? And moving from their point A to their point B, whatever their point A is, whatever their point B is, I feel I've done a good job at the end of the day when I've empowered them to make that move from that point A to that point B, right? And so no matter what I'm doing, no matter the situation, I can always go back to that phrasing of my values, and it kind of helps me to, to settle down and, have some perspective. Thank you. Okay. So let's talk about workability and committed action. Okay. So workability ultimately, when we're talking about committed action, is whether that action is moving you towards your valued self or not. It really becomes that simple in some ways, right? That when you are talking about values, if it is moving you away from your values, it is unworkable action. If it is moving you towards your values, it is committed action, right? And you want to start to use these terms. And you don't really have to define them too much. I found in sessions, they're pretty intuitive. I think they were well labeled, that you don't have to explain it to clients. After a while, when you tell a client that it's an unworkable action, is it moving you in the direction of blah, 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 they kind of get it pretty quickly, right? Okay. So let's talk a little bit about what unworkable action looks like. And we'll borrow a little bit from Russ Harris again here. And one category of unworkable action is distraction. This is where I have feelings, internal experiences I don't like. I don't like this stuff going on inside me. And so I am going to distract myself. I'm going to watch every new flick on Netflix because at least I can focus on that and I don't have to focus on my internal experiences, right? In most cases with distraction, it's meaningless activities, right? Sometimes it can seem to be meaningful activities, but again, if it serves the purpose of moving you, of not allowing you to pay attention to your internal experiences, it's probably a distraction, right? And we all walk around with a distractor at hand, so it makes it really easy for us to be able to just quickly zone out, right? Opting out, which is staying away from important people or situations, self-isolating. This is moving away from, right? When you start to move away from things because those things make you feel a certain way, right? That is an unworkable action because most times if the things that you're moving away from are things that are important or need to be addressed, and you're struggling with that, then that becomes unworkable. Overthinking, in some ways, is also a version of unworkable action. And this is where a good way to sort of think about overthinking versus thinking is that thinking is solution focused. It's about getting to a particular goal in a sense. Overthinking is a hamster in a hamster wheel type stuff. It's about worrying. It's about ruminating, right? It's about going in circles. And ultimately, it's about avoidance. Okay. Sometimes as with a client, when to kind of get them to get a sense of whether they're overthinking or thinking, I'll talk about what you're doing right now. Does it feel like you're a hamster in a wheel or a fox on a hunt? Right? A hamster in a wheel or a fox on a hunt, right? Hamster in a wheel is overthinking. Fox on a hunt tends to be goal-oriented, like you're trying to actually get somewhere. You're not just spinning. And then there's a whole bunch of unhelpful strategies that begin with the letter S. It just so happens. A whole bunch of them. There might be some that don't begin with S, but it doesn't fit my narrative or Russ Harris's, so we'll leave those off. But shopping, sleeping, stress eating, unhealthy sexual behavior, right? Suicidal thinking, right? All of those are attempts to control, change, avoid internal experiences in some way. And they all move us away from most likely who we are wanting to be in our lives. They're not values-based. Okay. Now, this is not saying these are not workable, maybe in the short term, right? Maybe we might need a distraction for a moment. So I think we don't want to kind of look at this list as the never do's. This is a list of you want to be careful of. You don't want to make it a pattern, right? Because we want to have that grace and that level of compassion for clients and for all of us as humans, that sometimes we will engage in these behaviors, in these activities, but we want to be careful. We want to kind of get a sense of what we're doing, and we don't want to make a pattern out of it, because then it really becomes unworkable. Okay. So what does committed action look like then, right? Any action that moves you towards your values or makes you more flexible in response to challenges. Committed action can mean a dedication to many different things. Once the client gets a sense of their values, then you can start to move them in a direction. Okay, so what are we going to do to make this real for you? And that could look like many different things. There is not one type of committed action. The committed action depends on the values of the client and the direction and what it is that they are willing or need to do in order to move in the direction of that value. Attending sessions regularly might be the committed action for some clients. Developing more flexible behaviors, right? If we look at interventions like behavioral activation, right? The struggle is that, I get this trigger, I engage in this behavior. And most times that behavior reinforces the state of affairs, right? Or the thinking that the client might be having, or the feelings that they might be having. And so finding ways to change and be less rigid about those behaviors and trying some new behaviors might be what committed action is about. Committed action might be engaging in a particular treatment protocol, right? Before I do exposure therapy, I want my client to feel that going through that difficult process is in line with who they are trying to be as people. Because it's a challenge. You're not going to get a client with OCD to do exposure therapy if it's not in line with their values. If you can't line it up first, it becomes very difficult. Then you're forcing them, and that doesn't work. Sticking with medication might be the committed action. Taking my medication on a regular basis, right? Going to see my psychiatrist, that might be the committed action. Changes in lifestyle or habits, trying new things, right? Engaging in self-care. Any one of those things could be the committed action that the client engages in to make their lives more meaningful, more rich, and more values-based. But you want to work with them to get to that point, because then they are more committed to the action. So let's talk about committed action in action, and let's look at a particular scenario. Oh, I'm sorry, some steps that you can take, right? So step one, let me move this so I can see on my screen, is to identify an area in your life where you want to make meaningful change. And that's its own work, right? Sometimes you have to work with a client to get to where, what is the meaningful change that you want to make? Then identify your values in that area of your life. You do some values-based work. And then based on those values, you want to set some specific goals to work towards that are in line with those values, right? Then you want to identify specific actions that are in line with those goals, that are in line with those values. And then you want to help them do it, right? So this is sort of the basic intervention for committed action, right? And if you kind of follow these steps, you can kind of help the client to make some progress. You want your goals to be SMART as much as possible, right? So you want it to be, when your client says, these are my values, and I want to develop some goals based on those values, you want it to be specific, measurable, attainable, relevant, time-bound. There are different ways to kind of, different people will use different ways to break down what SMART means, but I think this version kind of works, right? I am going to, somebody with social anxiety who is doing exposure therapy, I am going to talk to 3 people in my class this afternoon. That's specific. That's a specific goal that can be achieved, and it is in line with wanting to be more social, if that is the value, for example. And then when we have the goals, we want to help them to go to the actions. And we can ask questions such as, what actions are you taking right now, small or large, towards your values-based goals? You can ask the client that and help them to start to think about, are they actually engaging in behaviors that are moving them in the direction of their goals or not? Right? You can also ask, and we'll talk about this in a little bit, what obstacles are stopping you from taking action towards your values-based goals? Okay, so let's look at a scenario, and then maybe we can pause if there are any questions. So we have a client. Amira is a 20-year-old cisgender female college student who is struggling to engage with others on campus. She has a history of difficulties with connecting socially, right? So her presenting problems are all related to kind of social anxiety, loneliness, overthinking in social situations, nervousness around peers, and a whole bunch of other things. She feels others are just more social than me. So she has all kinds of beliefs that are not moving her forward. So let's say, we do our assessment and we think, this is a case of social anxiety and we want to intervene using ACT, right? We can try to get a sense of what experiential avoidance might be happening in this case, right? So we can talk to Amira about what feelings show up when you think about being social, right? So here's a scenario. Let's say you were to go outside right now and you had to speak with someone. What would come up? Anxiety, nervousness. She might feel uninterested, fearful. So that's the experiential avoidance piece. The fusion piece is, what is your mind telling you when you think about social situations? That they think I'm weird. And she's hooking onto that thought. She's not holding it lightly, she's holding it tightly. So of course it's going to drag her around, bully her. Self as content. What is the narrative that you have about yourself as a social being? Right? And you can kind of phrase that in a way that works for your client. But I'm a loser and nobody wants to be, friends, to be bothered with me. So why bother? Right? Dominance of the conceptualized future. I think I will say something stupid and embarrass myself. So she jumps in the future and knows she's going to mess it up anyway, so why try? So that is a dominance of the conceptualized future, and it's conceptualized because it hasn't happened. So in the treatment, we might want to use some workability and ask, is this working for you? You know, is it helping you be the person you want to be in the world? Like, is this how you want to live? Right? And if they're sitting with you, you can assume that they're going to say no, because that's why they came to therapy. Right? So then you can say, you know, how do you actually want to be in this world? What would be the version of you that you want to carry forward, to express? Right? And Amira might say, you know, making friends, connecting with others, sharing my life with others. Again, notice verbs, right? Actions in terms of values. And then you can say, if this is the truest version of yourself, Amira, do you feel your actions right now are helping you to be that person? And if you've done a good job of helping her to understand ACT and ACT processes, Amira is going to say no. And then you can say, if not, do you feel it is worth it to you to try some new approaches that may help you to be that true version of yourself? Right? Hopefully Amira says yes. And then you go into committed action. Well, Amira, I think that we might be able to help you to start to be that version of yourself where you are sharing your life with others and making friends. You know, there's this approach called exposure therapy, and then you explain it. You talk to her about it. She kind of gets it because now it's in line with her values. And then you start to set some goals, and then you help her to start to take actions. Okay. Any questions about that? I'm going to back up a little bit. I just wanted to pause.
Vidal, I have a question.
Yes.
I think this is a very good example, and I can imagine there's many individuals that deal with this type of social anxiety. Now, my question is, what if you have a client or a student who just gets so caught up with the experience of their emotions, you know, as you say, they're very big feelings, and they might get paralyzed, and there's a lot of fusion with these big feelings. So it's hard to, even though they know their values, they know what's important to them, they feel stuck and really enmeshed in those big feelings. What would you recommend in that kind of situation?
Absolutely. Great point, Dr. Nassim. And it's almost like I paid you to ask that question, because we're going to talk about the obstacles and barriers to implementing committed action. So the reality about committed action is that just because it's clear doesn't mean it's easy, right? The mind does not stop being the mind just because all of a sudden you figured out your values and you want to be this true version of yourself. Your mind is going to pat you on the head and say, good boy, good girl, that's nice. But what about all this other stuff? What about what happened in the past? What about these thoughts about yourself? What about these situations? It's going to start to do what a mind does, which is identify problems and try to give you solutions to those problems, right? Even though those solutions may not be so great. So committed action can absolutely be interrupted by many things, right? And so part of the job of the therapist, once you get to the point of committed action, is to work with the client to be able to address those obstacles and potential failures. There might be some setbacks, right? Some setbacks, and also helping the client to be willing to recommit to the values-based work, right? So what might get in the way? Your own mind might get in the way, right? And so that's why I think, you know, again, the Hexaflex is a great model, because you don't just get stuck at committed action. You can bounce back and use any of the other core processes to reinforce any particular core process, right? So helping the client to understand that your mind is not your friend. Stop expecting your mind to be nice to you. Now, it's not your enemy either, right? But it's definitely not your friend. What it is a tool. And just like any tool, it can be helpful or not, right? And you, as the owner of the mind, have to determine if the information that the mind is giving you is helping you to move in the direction of your values or not, right? The thoughts that come up, the memories that come up, the sensations that your mind focuses on, the triggers, all of those things are in your mind, and your mind is presenting this information to you. And you, as the boss of your mind, not the other way, right? Your mind is not the boss of you. You are the boss of your mind. You can look at that information and say, this works for me, I'll put it here. That one doesn't work, I'll toss it away, right? Or I can just leave it there, right? So the mind can be a challenge, right? When it starts to do this kind of stuff, right? Yeah, but, right? What if only your feelings can also be a barrier. Unpleasant and unwanted feelings can be difficult to manage, and they can get in the way of values-based action. Our actions, our habits, right, can also be unworkable and can get in the way as well, right? Our actions, our inaction, impulsivity, rigidity, those can get in the way as well. Okay, and so we might need to address those. Your environment. You may have to make some hard decisions about your environment because your environment might be filled with triggers that are not valued, that don't support values-based living. So you're gonna have to do something about that, right? So there are many different things that could present themselves as interrupters of good committed action work. Okay. One of the ways that it can be kind of talked about is with this acronym of FEAR, but it kind of gets sort of at what we were talking about before as well, where, you know, fusion with unworkable thoughts can get in the way. Excessive goals, when the goals are not set right, they can also lead to barriers for an individual, right? You know, for a lot of clients, when they understand their values and they get a good sense about acceptance and diffusion, sometimes they think that that's it. And they feel like they can now leave the session and go out into the world and everything's going to be better because I know how to diffuse, I know how to not experientially avoid, and I have my values, right? But that's where you have to help them to understand that, no, you have to engage in the committed action and you have to learn to use the tools of acceptance and diffusion and self as context as ways to unblock some of those challenges that might get in your way as you start to actually make the behavioral change. Okay. Avoidance of discomfort can also be a barrier, right? Because, you know, to choose to grow is to choose to be stressed, right? To choose to grow means you're inviting some new challenges into your life, right? And so sometimes that discomfort that comes with change can be difficult to manage. And then there's also the remoteness of values. Sometimes in the process of doing committed action, we lose focus of the values, right? So FEAR is a good acronym. And the opposite is DARE, right? So you want to use diffusion, you want to use acceptance of discomfort, and all the different types of work that goes into that. You want to revisit the values, you want to revisit the goals, and then you want to make adjustments as necessary. And again, psychological flexibility is part of health, and psychological rigidity is part of suffering. And so you want to help your client, even as they are engaging in committed action, to be focused on remaining flexible. Okay. Here's a little cartoon. It seems like your negative thoughts and emotions stand in the way, stopping you from going in your valued direction. But really, these negative thoughts and emotions are just along for the ride. They show up and they say, turn right, but you can still choose to turn left. Sometimes the way I will talk to my clients is to help them to understand that you don't want to choose your actions based on your thoughts and your feelings, right? Because thoughts and feelings are fleeting. They're just bits of data, right? You rather want to choose your actions in alignment with your values, right? So sometimes if a client says, yeah, but, you know, the last time I tried, it didn't work. We can say, okay, I hear what you're saying. Now, what you just described to me, right? Was that a thought that just popped into your head? And they'll say, yes, that's a thought that just popped into my head. And you can say, yeah, that thought is real. What you're referencing, what that thought is referencing is a real thing that happened to you, right? Now, the question is that thought and focusing on that thought and holding on to that thought, is that thought helping you to be able to engage in your values-based action, or is it getting in the way? Doesn't matter if it's true or false. We're talking about whether it's helpful or not. And using that type of language with clients, helpful or not, versus true or false, right, is a way to help them to start to think about moving in their values-based direction and how to commit to the actions that are related to that, and to not focus on their thoughts and their feelings, but to focus on their values and being able to take those values-based actions. Okay. I also wanted to point out the role of self-compassion in doing committed action work, because there will be struggles, they will get stuck, there will be setbacks, right? And self-compassion is simply the process of turning compassion inward, being kind to oneself, right? And being understanding rather than harsh and self-critical when we fail, make mistakes, or feel inadequate. We give ourselves support and encouragement rather than being cold and judgmental when challenges and difficulties arise in our lives. For those of you who have done self-compassion-based work before, this will be familiar to you. For those of you who are not, it's a good way to help clients to sort of to be in the present moment of their experience and to not get caught up when things don't work out very well for them. The three core concepts from Kristen Neff include being self-kind as opposed to being self-judgmental, right? Doing nice things for oneself. Sometimes you can ask a client, if this were someone else telling you this story, right? What would you say to them, right? Because a lot of clients can be compassionate, but they struggle to be self-compassionate. So if you give them an example of where they can be compassionate, they can then use that as a stepping stone to how they can also be towards themselves in terms of being kind, right? You can also connect them to their common humanity, that this is tough stuff. This is not easy, right? Being human is not a piece of cake. It can be very challenging, right? As opposed to having them sort of pull away their experience and see it as my failure, my disappointment, right? A criticism of themselves, you kind of bring them back into the fold of common humanity. And then also using some mindfulness techniques can be very helpful as well in helping clients to become self-compassionate, helping them to think about their experiences in a way where they are holding it more lightly, they're creating space for it, they're allowing it to be, as opposed to allowing it to dominate, control, and for them to be over-identified with a particular feeling or thought. Okay. So as we're approaching the end, I wanted us to do another scenario, but this one will be interactive, right? We're gonna talk a little bit about this one. And what I will do here is I'll also allow me to talk about how, like, actually what I do in a particular session. So this is kind of based on an actual client that I have been working with. And so I'll talk about some things that I actually did and in terms of committed action and how that worked. Okay. So Chris is a 13-year-old cisgender male with a history of non-compliance and conflict with parents. In my early work with him, I also found out that he had engaged in some inappropriate sexual behaviors with a younger sibling. Okay. The presenting problems for Chris was a lot of lying and dishonesty with his parents, making these suicidal and homicidal statements when he wasn't getting his way. He actually ended up in the emergency room at one point because he made a homicidal statement about like unplugging the gas. He was upset because he didn't get something when his parents asked him, and he just kind of made the statement, kind of mumbled it, and his parents freaked out and like, oh my God, what are you talking about? He also makes poor decisions in terms of taking care of himself. The issue with the inappropriate sexual behaviors is not my specialty for this age group in terms of working with someone who is a perpetrator. And so I had to refer him to a treatment program for a period of time that works with young intra-family sexual abuse types of situations. And he received some good work in that area. And then he returned to me after he received that treatment. And we tried to continue to work on some of the other issues that were still going on. And so I wanted to use ACT to work with him. Now, using ACT with a 13-year-old can be challenging because ACT was really developed for adults. But there has been a lot of process in the work of Louise Hayes and other people to kind of drop that age limit for ACT a little bit. And there are some pretty good interventions now that you can use with younger clients. All right, so let's kind of go through the treatment. So diffusion. What is your mind? So one of the things, let's say, so I kind of boiled this down to the area. So working on diffusion with him, what is your mind telling you when you think about your relationship with your parents? Was a question I kind of asked, more or less, right? And he talked about how he didn't feel like they loved him and they never make time for him. They just want me to do what they want me to do and never allow me to have any fun, right? So there was this sense, right? Every time he interacted with his parents, his mind would tell him that these people don't love you. They're not interested in you. They just want you to do what they want you to do. They're not interested in your life. They want you to live their lives. It's all about you doing what they want. And this was very frustrating for him, very overwhelming for him. There were other factors that played into it, but this is what the thoughts that he was fusing with. Okay. Acceptance. So now I focused on his feelings. What are the feelings that show up when you think about your relationship with your parents, right? So just based on this situation, what might be some feelings that you feel like this young person might have? What might he say?
He's resentful because they stand in the way of him getting what he wants.
Absolutely, yes. Resentment was one thing that he absolutely, once given the opportunity to talk about it, he was able to say and communicate that he was resentful towards them, right? He also felt a lot of fear of them, right? Because he saw this power differential where they don't care about me and they're just going to make me do what they want me to do. They are not interested in me. He was very angry at them, right? He felt rejected by them and he felt hopeless that things would ever change. And so, which kind of suggested why he was making some of these suicidal and homicidal statements. It was like, this is my lot in life. It's never going to get better. And these people who don't love me are just going to torment me, for the rest of my life. Okay. So then workability. I started to talk to him about this now that after we did some acceptance-based work and some diffusion-based work. So I kind of asked him, is the lying and the bad decisions and you making these statements, is that working for you? Right? Is it helping you to be the type of person you want to be in the world? Like, does that feel like how you want to be as a person? Right? So now I'm moving him towards workability and towards values. Challenging with a 13-year-old, but you kind of want to get at that sense of how do you wish yourself to be at this point in your life? What is the version of yourself that you are trying to bring into existence? Right? And then once he started to be able to talk about that a little bit, then we started to talk about how do you want to be with your parents? Right? And he talked about a lot of different things. He did want to be truthful with them. He did want to be more honest, but he also wanted a little bit more independence and freedom. And he wanted to be mentally healthy. He knew he wasn't doing well, right? And young people nowadays, they're able to kind of put words to, they will talk about their mental health, right? And so he was able to talk about that. He was able to say, I don't feel well. I don't feel like I'm doing okay. Why am I going to the ER? Like, how did I end up going to the ER, right? And so moving him forward, I said, so if this is the truest version of yourself, if you feel like this is who you want to be, then do you feel like the actions that you're engaging in currently, is that helping you to be that type of person? Is the lying and the, making these statements, is that consistent with wanting to be more trustworthy and honest and things like that? And of course he says no, right? So then I move to committed action. Well, if not, do you feel it is worth trying some new approaches that might help you to be this more true version of yourself with your parents? Right? So you see how we kind of move to that, right? And then to talk about what that committed action would look like. And on his own and doing the work together, he talked about being more truthful, making better decisions about my chores and other responsibilities, being more appropriately expressive with my parents as opposed to making threats. Because it became very clear to him that when he engaged in the other ways, he actually lost privileges. And that when he was able to kind of be more honest, he gained privileges. Because his parents weren't monsters. They wanted their son to be healthy and to have a good relationship with him. So to kind of bring his attention to that, it kind of helped him to be able to commit to certain types of actions. And so then we began working on what the committed action would look like. We set some goals, right? And the way that we kind of tracked the goals was whether he had his cell phone or not. Because when he got in trouble, he didn't get his cell phone, right? When he was doing okay, he had his cell phone. So then that was the privilege that meant something to him. And so being honest was something that we talked about. And in terms of thinking about the obstacles, right? One of the things that we wanted to do was for him to get a sense of what are the circumstantial triggers that make you lie as opposed to tell the truth in a given moment, right? Because that's an obstacle that he was going to come up against, right? He had a habit, and in order to break the habit, he had to have a good sense of what triggers him to engage in the old behaviors. And so this is an activity that I sort of kind of made up some years ago. And the idea of this is really just a list of some unwanted feelings, right? And the idea is how much are your feelings affecting you at this point in time? And under each feeling is a rating from 0 to 10, with 5 being in the middle. And then 0 is no problem at all. And 10 is it's a really big problem. And the idea is it's just a rating scale for clients to be able to use. But this is where we bring in the acceptance core process, is that I don't want the client to think that these are feelings that need to be controlled or gotten rid of, but to see them more as data, as information, and that understanding what these feelings are will actually help him to have better control in situations. And so before he rates any particular feeling, we talk about the feeling. So we say anger. We're going to talk about anger. What is anger, Chris? Right? Well, let me tell you what anger is. Anger is when you feel disrespected, threatened, or hurt by someone. Right? That's a feeling that comes up that makes you want to protect yourself, want you to defend yourself, and to push away the source of the person or thing that is making you feel threatened or disrespected. And then based on that definition, now do a rating of it. And then we move to the next one, sadness. What is sadness? Sadness is about loss. And then I give an explanation, stuff like that. And then he does the rating. So what he's doing is not only identifying important feelings in his life that might be obstacles to his committed action, but he's also learning about what each feeling is. Because some feelings are confusing, right? In mainstream conversation, we use jealousy and envy interchangeably, but they're not the same. Shame and guilt are related, but they're not the same, right? And so helping him to understand those gives him a little bit of nuance to be able to understand, that's the feeling that shows up inside of me that makes me lie. When I feel ashamed, that's the feeling that makes me lie. And once he can put words to that, then we can work on shame to help him to then be able to choose a different behavior in response to that feeling, as opposed to one that is unworkable. Okay. So I'll be happy to share this if anyone feels like this might be helpful for them and their clients. Here's another one that I use just to kind of help with assertive communication. And this one is just kind of like a stem with a blank. When I blank, I am feeling blank and I need blank. And they can fill, clients can fill this out in any way that works for them. When I blank, I am feeling blank. When I cry, I am feeling lonely and I need to be with someone. When I lie, I am feeling angry and I need a moment, or whatever it might be. So you use the stem as a way to help the client to kind of like, how would you fill in these blanks? Because again, it helps them to be able to put words to their internal experiences as opposed to trying to control it and change it and all this kind of stuff. And then also it allows for them to learn how they might be able to communicate this to another person. Because he could actually say this to his parents. When I lie, I'm feeling resentful, and I need you guys to listen to me. Right? That helps to give him the words to engage in the committed action of assertiveness in this particular case. So that was one of the things that we used with him. And then the last part is assessing his progress. And so I had talked about in the beginning how in ACT, your clients come to you somewhere within rigidity and flexibility, and you're trying to move them in the direction of flexibility. So how do you do that? I like these rating scales, as you can see, right? But this rating scale is really around what we had talked about before, being open, being present, and being engaged. And then at the bottom is the opposite of that, being closed, right? Being focused on the past and the future, and being disengaged from one's values. And so as we progress through the treatment and we're getting to a point where he's actually making progress in terms of committed action, I pull this out and I'll say, let's see how well you're doing. Why don't we give a rating about, 3 months ago when I met you, where were you in terms of being open to your thoughts and your feelings, or being in conflict with your thoughts and your feelings? Then he gives a rating. And then I say, where are you now in terms of being open or closed with your feelings and stuff like that? And then he gives a rating. Where are you in terms of being stuck in the past and just focusing on things that happened in the past, or just always worried about the future, right? Or being able to be in the present moment. So where are you then? Where are you now? Right? We did some values-based work. So being disengaged from your values, being engaged with your values. Where are you then? Where are you now? Right? So again, using this rating scale allows the client to reflect on their own process, understand the benefits of their committed action, and to also see their growth and their progress, right? And again, it's not a standardized scale. It's really a self-report measure that forms the basis for conversation in treatment. Okay. So that's Chris. And in working with him, that's sort of how we sort of go through ACT and then focus on committed action and try to get him to a point where he is improving his relationship with his parents. Okay. So I did want to, that brings me to 11:25. That might leave a little time for questions, but I want to thank you all for listening and paying attention. And I'm here. If there are any questions, I will be more than happy to answer them and engage in conversation. Thank you.
Wonderful. Thank you so much, Dr. Annan. This is an incredible talk, so informative, so much information. And I really love the examples that you gave, really putting into committed action into action. If anyone would like to share any questions, please feel free to unmute yourself and ask any questions, or you can place them in the chat box. And for those who are paying attention to the chat box, we do have a couple of our upcoming events listed as well, including our upcoming ACT and Process lecture. We have a talk with Dr. Jennifer Kemp and a few others as well. So feel free to take a look. Let's see if we have any questions.
I have a quick question around self-compassion. When I work with my clients, it's often something that I'm trying to make it fit into the framework of ACT, and I try to help my clients to see that self-compassion can be a value. But from like the conceptualization and like the ACT-Flex framework, like how do you see self-compassion fitting in?
Yeah, that's a great question. I think self-compassion is consistent with quite a few of the core processes. But what I have found is that it's best introduced when the client needs self-compassion to be unstuck, right? So I try not to introduce it as a concept that they should sort of learn and practice on a daily basis, right? I find it most helpful when they are stuck and they're beating themselves up and they're listening to their minds, right? And there I usually will start off with something like, I see that your mind is being really hard on you right now, right? It's really beating you up. It's really kicking your butt, right? If a friend of yours told you the story that you told me right now about what is going on, how would you respond to your friend, right? And then you use that compassion as the first step. And most people are able to say, yeah, I would tell them it's okay. I would tell them like these things happen. I would tell them not to be hard on themselves. They would say something along those lines. And then I say, is it possible for you to show yourself that same type of care and kindness and compassion as you would to a friend? Is that something that you can do for yourself right now? And a lot of times it may be the first time that they've even thought about it that way. But when you introduce it in that moment where they are actually engaging in some suffering, where they're kind of stuck, they're more likely to be open to it. And then once we talk about it, then I'd sort of talk about the theory of it, right? Because I think they're more open to understanding more about it once they have used it for themselves. Put your hand on your heart, right? And feel your own heartbeat and feel how you are struggling right now. And is it possible for you to project some kindness to yourself as you would to your friend? Something like that, right? And then they do it. And then they usually will tend to feel better, a little bit better. And then I introduce the theory.
Thank you so much. This was such a great presentation.
And I wanted to kind of end with this quote as well. I really like it. Yeah, I like quotes. And again, in ACT, quotes work like a charm. I mean, you can use 1,000,001 quotes in ACT. It's part of that whole idea of metaphors and comparisons. And it says, if you are facing in the right direction, all you need to do is keep walking. And I think that that's consistent with values and committed action and that kind of thing.
Right.
Any other questions or anything? I think we're down to 30 seconds. I'll try to give a 10-second before Dr. Nasim cuts me off.
We really appreciate the lecture and everyone's participation, and feel free to send any additional questions. We love further engagement, especially if you guys are interested in further topics of discussion in relation to ACT and the processes of ACT. Let's see. Okay. All right. Well, thank you all for your time. And again, let's get a little round of applause for Dr. Na for the incredible presentation and for really helping us with developing some committed actions in ourselves with our clients and with our practices. And just as a quick reminder, we do have a couple of events coming up with NYC ACBS. We currently have a training going on with Dr. Ryan Delap about supporting young people of color, and this is with Praxis. We also have Introduction to Neurodiversity, Affirming Practice with ACT. This is with Jennifer Kemp, and this is coming up on Thursday, May 2nd. We have NYC ACBS. We're sponsoring barbecue at East River Park on May 4th. So may the 4th be with you. And we'll be having some vegetarian and meat options. So we'll have something for all type of dietary restrictions. And then we're also going to have the last lecture of our Act and Process series, which is going to be an RFT primer with Brian Mundy. And that's going to be on Thursday, May 9th. So we hope everyone's looking forward to our upcoming events, and have been, once again, thanks to everyone here, especially Dr. Annan, for being able to present for us, and hope you guys are all looking forward to more future events.